Hello everyone, welcome to Simsad Aesthetics. I am a professional esthetician and cosmetologist. Have you ever noticed mysterious, coin-shaped rashes on your skin that itch like crazy? It may be nummular dermatitis or nummular eczema. In this video, I am breaking down everything about nummular dermatitis, from the hidden triggers and real risks to the latest treatments and exact preventions. So subscribe my channel, and stick around. What you learn in the next few minutes could finally bring you the relief you have been searching for. 1. What exactly is nummular dermatitis, causes and triggers? Nummular dermatitis is a distinct type of inflammatory skin disease characterized by its unique presentation of round or oval-shaped patches, or plaques, that look like coins scattered on the skin. While the precise, singular cause of nummular dermatitis remains a mystery to science, it is widely understood to be the result of a perfect storm involving genetic predisposition meeting various environmental triggers. The central player in this process is a compromised skin barrier, when the skin's outermost protective layer is damaged. Think of healthy skin like a well-built brick wall. The skin cells are the bricks, and a fatty, protective matrix acts as the mortar that holds everything together and keeps moisture in and irritants out. In individuals predisposed to nummular dermatitis, this mortar is genetically weaker or becomes compromised. Simultaneously, this cracked barrier allows everyday substances, like soaps, metals, fabrics, or microbes, to penetrate deep into the skin where they don't belong. The immune system identifies these invaders as a threat. It launches a vigorous attack, releasing a flood of inflammatory signals and cells to the site. This inflammatory response is what causes the visible and physical symptoms: redness from increased blood flow, swelling from fluid buildup, the formation of bumps and blisters, and intense itching caused by inflammatory chemicals activating nerve endings. The distinct coin-shaped pattern is believed to be the result of this inflammatory process spreading in a localized, circular manner, often starting from a central point like a minor cut or insect bite. Therefore, nummular dermatitis is not a simple skin rash but a visible outcome of a complex immune system reaction to a broken skin barrier. Its main causes are people who already have dry skin are far more susceptible, especially during winter months when humidity is low. Moreover, even minor trauma can instigate a lesion. This includes abrasions, burns, insect bites, and surgical scars. This is known as the Koebner phenomenon. This is also a cause. Contact with metals, especially nickel, formaldehyde, certain fragrances, harsh soaps, detergents, and wool can trigger flare-ups. Both very cold, dry weather and very hot, humid weather that causes excessive sweating can be problematic. Emotional and physical stress is a well-documented trigger for many inflammatory skin conditions, including nummular dermatitis. Certain drugs have been linked to the onset of nummular dermatitis, including interferon and isotretinoin. Some studies also suggest a link with poor blood flow or venous insufficiency in the legs, particularly in older adults. Section 2. Who is at risk? While anyone can develop nummular dermatitis, certain groups face a higher risk. The condition distinctly targets two primary demographics: men between the ages of 55 and 65, and women in their teens and early adulthood. Individuals with a history of other skin conditions like atopic dermatitis, contact dermatitis, or chronically dry skin are significantly more susceptible due to their already compromised skin barrier. Environmental factors also play a key role. Living in a cold, dry climate can severely parch the skin, triggering flares. Furthermore, occupational hazards are a major risk, as jobs involving frequent hand-washing, or exposure to chemicals, solvents, or metals, can perpetually damage the skin and act as a constant trigger. Section 3. The gold standard, diagnosis, you will experience. If you suspect you have nummular dermatitis, it is absolutely essential to consult a board-certified dermatologist or esthetician, as self-diagnosis and treatment can often worsen the condition. The diagnostic process is methodical and designed to rule out look-alike conditions. Typically begins with a thorough visual examination, where a dermatologist can frequently identify the condition based on its distinctive coin-shaped, well-defined lesions. This is followed by a detailed medical history, where the doctor will ask about your personal and family history of allergies, asthma, and eczema, as well as potential triggers like new soaps, detergents, or recent periods of high stress. To do this, the doctor may perform a KOH test. Finally, in rare persistent or diagnostically unclear cases, a small skin sample or biopsy may be taken and sent to a lab for histological analysis to confirm the diagnosis and definitively rule out other conditions like psoriasis or cutaneous lymphoma. Section 4. Best and latest treatments for nummular dermatitis. Treating nummular dermatitis requires a multi-pronged strategy. The absolute non-negotiable foundation of any treatment plan is the consistent use of medical-grade moisturizers, known as emollients. These are not just simple lotions. They are therapeutic products designed to repair the skin's broken barrier, lock in essential moisture. Look for products that are fragrance-free, dye-free, ceramide-dominant, formulated for very dry, sensitive skin. According to me, based on these criteria, one of the most highly recommended and dermatologist-supported product lines is CeraVe. A specific and excellent choice is the CeraVe Moisturizing Cream, often found in a jar or tube with a blue and white label. When a flare-up occurs, the first-line medical intervention is typically a topical corticosteroid. These are powerful anti-inflammatory medications that work quickly to reduce redness, swelling, and, most importantly, the intense itching. But consult a professional esthetician or dermatologist for this. For sensitive areas like the face, or for long-term management where continuous steroid use is a concern, dermatologists often prescribe topical calcineurin inhibitors, or TCIs. Another highly effective option for moderate to severe cases is phototherapy, or light therapy. This isn't just any light, it involves controlled exposure to specific wavelengths of ultraviolet light, usually narrowband UVB, under strict medical supervision. This treatment works by reducing inflammation and itch and typically requires a commitment of 2 to 3 sessions per week for several weeks to see maximum results. It's also important to address complications. Because the oozing lesions are often scratched, they can easily become infected with bacteria. Section 5. Answering your top searches, people also ask. Question 1. What is the fastest way to get rid of nummular eczema? Fact: there is no instant cure, but the fastest way to control a severe flare is to see a dermatologist immediately. They will likely prescribe a short course of a potent topical corticosteroid. Question 2. Does nummular dermatitis ever go away? Fact: yes, it can. For some people, especially younger individuals, nummular dermatitis can clear up completely and never return. For others, it is a chronic, relapsing condition that flares periodically throughout life, often in the same spots. The goal of treatment shifts from curing it to effectively managing flares, minimizing symptoms, and extending the periods of remission. Question 3. What deficiency causes nummular eczema? Fact: there is no direct, proven link between a specific vitamin or mineral deficiency and the cause of nummular dermatitis. However, some research suggests that low levels of vitamin D may be associated with increased severity of eczema in general. Maintaining adequate levels of vitamin D through diet, sunlight, cautiously, or supplementation may support overall skin health and immune function, but it is not a standalone treatment. Section 6. Long-term management and prevention for nummular dermatitis. Managing nummular dermatitis is a marathon, not a sprint. Make daily moisturizing a non-negotiable ritual. Become a detective with your own body. Identify your personal triggers by keeping a symptom diary, and then avoid them meticulously, whether they are certain metals, chemicals, fabrics, or stressors. Adopt a gentle skin care routine. Use lukewarm water for short baths or showers and gently pat your skin dry. Choose only mild, fragrance-free, and soap-free cleansers to avoid irritation. Your clothing choices matter. Always opt for soft, breathable fabrics like 100% cotton or silk directly against your skin, and avoid rough, scratchy materials like wool. Your environment plays a key role. Using a humidifier in your bedroom during dry months can add essential moisture to the air and prevent your skin from drying out overnight. Breaking the itch-scratch cycle is critical. Keep nails short and smooth. Consider wearing cotton gloves at night, and apply a cold compress to itchy spots instead of scratching. Since stress is a major trigger, incorporate management techniques like meditation. Final verdict. Remember, while nummular dermatitis can be challenging, it is manageable. With the right knowledge and a consistent care routine, you can calm the flare-ups and reclaim your comfort. Thanks for watching, share this video, and don't forget to subscribe for more health insights.